or we'll move to the next session by Shashank. We have always been saying how doctors are lapping on the technology platform. Given the work that Practo has done, which Shashank founded, and the way he's been driving this globally, let's hear from him what he has to share with us.
Good afternoon, everyone. Thank you for this opportunity today to share with you our thoughts at Practo. As you've seen earlier today, there have been different architectures on how healthcare information systems can be put together, and I'm not going to be presenting one more. I'll be probably talking to you a little bit more on introducing you to what we do at Practo, and sharing with you, as Rajendra shared earlier, about the state of digitalization that exists at the ground level in India today, a work that I have done over the last 8 years, along with my teammates at Practo. And the third part is to talk to you about the absolute opportunity that we have here today, and something that's very, very exciting for us, and my thoughts on that. To start off with, this journey of mine, just to give you a quick snapshot, started about 8 years back, and it's very funny. It started on the same premise with which we are here today. 8 years back, my father was needed a knee surgery, and I was struggling to get his reports to a doctor in the US. It was all in paper format. It was printed, but on paper. So I go back to this doctor of mine, asking him for a digital copy. I tell him that, why can't you just email it to me? It's on computer, so it can very easily be emailed. And he said, Shashank, I wish I could do that for you. Many patients have asked for it. But unfortunately, the software that I'm using only has a print button. It doesn't have an email button. And this was the insight that about 8 years back, while I was in my undergrad, gave me the idea that founded Practo, which was on the basis of interoperability, that why can't data move around better, and so that consumers like us can have a much better healthcare experience, not just for ourselves, but also for our parents, our children, and everyone involved. Why can't we have an integrated health record of ours? So it was on this premise that we started building out the solutions that we today have under Practo. And we genuinely work towards, like all of us today here, to helping mankind live healthier and longer. But the way we do it is we add that technology component, connecting the different facets of healthcare through technology. So today, just from a standpoint, we do about 40 million appointments on our platform. Largely, these are numbers on India. So it's almost 1 in every 5 appointments in the top 10 cities happening on our platform today. We have also been able to take what we have built, which I'm going to talk to you a little bit about before I deep dive into some of the aspects of digitalization. We have been able to take this technology of ours to other countries. It's in one of its kind. So we've been able to take it to Southeast Asia, Latin America, Middle East, and with a lot of developing economies, basically. So what we do at Practo, for those who are new to our platform, is we help the consumer through his entire journey of healthcare. And we are not a provider, which means we have we only work with providers like hospitals, doctors, clinics, nursing homes. We work with providers like diagnostics, pharmacies. We own none of the assets, nor do we intend to own any of them going forward. We are clearly just a technology layer that works with the different facets of the ecosystem to provide a very seamless experience for the consumer. So starting with finding a relevant provider. So we have about close to about 120,000 doctors on our platform that we have verified and who are on our platform today. We cover more than 100, close to 100 cities in India. We then help the consumer have a telemedicine experience where he can ask a question to the doctor right on his app, followed up with a booking an appointment by looking at a schedule that's available to him. And then we also help with the registration of the at the provider's end, followed up with the creation of health record, paying for a service, getting lab tests, health medicine delivery, and the whole circle. So it's the entire loop that we call the hyperloop that we at Practo focus on. So we are as close to the consumer as we can get, and our focus is on all these elements, and working with the different providers to deliver this experience to the consumer. So these are the things that we provide to the consumer today. Finding doctors, we have we have information about, very detailed information about doctors. We have mapped, for example, in the top 6 cities, 56,743 establishments, SMB establishments, whose PIN code, geotags, as well as their photographs are all on our website, and we, on a regular basis, update that registry of SMBs. Similarly, for different hospitals, we have the same information available on our portal. Someone today spoke about the information asymmetry that exists in healthcare, where there is information that is there in the healthcare domain, there's information that consumers want. We're trying to bridge that gap through our find the right provider solution. Consult is our ability to help the consumer instantly talk to a doctor, talk to a provider. It could be it could be even to a establishment to just get the direction, or it could even be a quick message to the doctor for a follow-up. Since we are on the mobile phone of the doctors, we are able to provide really quick response times of less than 15 minutes. Booking appointments, we have the schedule of the doctor, so we're able to provide precisely when the patient can actually meet the doctor with very little waiting time. So in many large hospitals, we've been able to reduce it from a couple of hours to less than 15 minutes. So on, we have medicine delivery, diagnostic test checkups, as well as managing health records. This is what we do for consumers. What's very unique about Practo is that we not only provide these services for consumers, but we also have a pretty full stack solution for the providers as well. Over the last 8 years, both software and hardware solutions built in India for Indian doctors and for Indian practices at Practo, be it Ray, which is a practice management software, or a tablet of ours, which is the hardware that is given especially in Tier 2, Tier 3 cities where there is no internet connectivity and there's no power. Our hardware devices come in very, very handy. Insta, which is a hospital information system. Quickwell, which is an appointment management system for large hospitals. And Querent, which is our product towards analytics. So this is our offering to the provider space. We also have similar offerings to the payers, where they can generate awareness or bring in connectivity or bring in enablement. So these are the 3 aspects of healthcare that we touch. We provide solutions to consumers, solutions to providers, and solutions to payers. But I'm here today to share with you my views on at the ground level, the realities of digitalization. 8 years back, when I started to build a software for doctors, the biggest problem that I had was the adoption. We have seen it worldwide. The biggest trouble providers have, specifically doctors, is they're short of time. And incentives need to be lined up precisely, very, very effectively for them to adopt technology. If it's a hospital, it's usually the hospital owner who's either having very localized incentives for the hospital to adopt technology. But at a really massive scale, the data that we have shows that there is really a big lack in digitalization. On the ground level, when we started off, when we did a quick survey, 95% of small and medium-sized centers in India today, where 40% of healthcare is delivered, had no technology. It was just pen and paper, 95%. Today, the scenario is not too different, but it's still largely pen and paper, which means that data today in healthcare is still largely on pen and paper, which is a point that someone brought up today about the OPD data, which is still largely on pen and paper. So the data I'm referring to is largely on the outpatient side. The other challenge that we have seen is even when we provide technology tools to them, even when we provide the best of technology, the simplest of UI, touch of a tip, be it mobile, be it web, be it right at their fingertips, there's a real lack of incentive for these providers to adopt technology. With the lack of penetration of insurance and really lack of motivating factors for motivating factors for the providers, there's really a big problem that we face in incentivizing providers to use technology. And so I think that, and we have enough data to share, which shows the massive gap that we have in the country today with respect to data, which is really largely on pen and paper, largely on manual basis. That's the fastest way healthcare has worked in terms of its workflow. In developed economies, because of the focus on insurance, we've seen different incentive models where technology penetration has been much better. So I think the large question that's upon us today is, how do we really incentivize the providers? How do we really incentivize the hospitals to pick up this technology and start using it? So I think that's where it's a largely open question, and I think there was some house rules put up early today that, if you have to criticize, you also provide a solution. So I think there is a solution, and today is a great moment that the government of India is focused on solving this problem, and is on the side of digitalizing health data. But I feel the criticality lies in how are we going to solve the problem. Luckily for India, we are born in a digital age, and we can probably leapfrog the offline age, which means that when the systems of the US, UK, and many other countries were created, they were created when systems were offline. And so they're largely offline systems that were created. And hence, most of the architectures for integrated health exchanges were created in an offline era. They were thought about in an offline era. But luckily, India's problem has come when digital solutions exist. So I believe that the architecture that needs to be created needs to take into account of this, of the digital nature, and be built in a digital nature, which means that we need to use the internet. We need to use and create an architecture that takes internet into account, and a new model, a new architecture can be proposed using the internet, which can make sure that we can really get high penetration of the HIE, and also, most importantly, touch the grassroots level and make sure there's real adoption. That's the first advantage India has, that we are building the HIE in an age of the internet. And that's an advantage that we have that no other country before us had. Each and every doctor today in Practo uses a mobile phone and uses our systems largely from the mobile phone. He does not use our mobile web. Doesn't use our web. He uses a mobile phone to manage his appointments, to update his patient records, to take his prescriptions, and much more. So I highly urge the architecture to take into account this ability for us to use the internet. The second biggest advantage that India has is its very highly innovative technology base, which means that if we can leverage and monetize all partners involved in this effort, I think we will go a long way in getting more companies to digitalize. If companies are at the grassroots level incentivized, and if providers are rightly incentivized with a good model, we will see a large-scale adoption that no other country has seen before. We have seen that even after spending $30-40 billion, the adoption in many of the developed nations is very pathetic. And I think if India really needs to leapfrog this, it needs to make use of this opportunity to build the right incentive model as well for both providers and for technology implementers to participate in the HIE and make sure that it can be a grand success. But nonetheless, I think it's a great start, and it's fantastic to be part of this forum talking about a solution that can revolutionize the way healthcare has happened. And I'm very, very confident that in our generation, we will be able to see integrated healthcare system in India that can deliver good healthcare for all. Thank you.
Thanks, Shashank, so much. I think within the government also they started booking appointments, through use of internet. So I think the thrust is equally from both the sides. Given the experience you had and the government had, if you are able to leverage the learnings and make it a little easier in terms of adoption, I think it would make success story. Otherwise, we'll have the biggest roadblock, as we always say. Any comments or questions to Shashank, which is important? I think this is of very deep interest to anyone sitting out here, looking at success of IHIP.
Shashank, this is Sandeep. So if we look at banking penetration, telecom penetration, FMCG penetration in the country, it is almost like 6 lakh villages. So for a hospital, it may be very difficult, but for Practo, I think it should be easy. So what are your thoughts on that, to reach the last village of the country?
Thanks, Sandeep. You're absolutely right. I mean, in top 6 cities, today Practo as an overall company, we're about 2,000 Practions. And most of our base is towards an outreach program of ours, where we have people on the ground meeting doctors and getting them on board. Almost 60% of our team size would be towards this effort of ours. We have gone right up to the right up to the tier 2, tier 3 cities. And we see there's a lot of enthusiasm in the provider space there to adopt technology. So our tablet, for example, which is an offline tablet, was designed with that intent and had seen better adoption in tier 2 cities than in tier 1 cities for a brief moment in time. So there's a lot of enthusiasm, but the problem that we face, and I'll be very open about this, is that the economics have to also fall in place, which is where I feel that in tier 1 cities we've seen extremely healthy economics, but in tier 2 and tier 3 cities, I think there's still a lot more to be desired from an economic model. But just from a excitement point of view, the providers have a great excitement. I'm part of many initiatives, including the one that the Rashtrapati Bhavan just launched in Haryana, where they launched telemedicine sites, which were a Rajasthan company that did it in Haryana, where villages, the remotest villages where the poorest MRRs and IRRs exist, in those places, there's been the use of telemedicine has seen a great improvement in those numbers. So technology can penetrate, and there are a lot of enthusiastic innovators in the country who can make that happen. My only worry is the economic model in that sense.
Compliments to you for taking a lead. My name is S.K. Sinha. I am from NIC. I am Senior Director there. You told that you have solutions for various small clinics, middle-level hospitals, large hospitals. My first question is that are these solutions sharing their data among each other? Okay, number one. My second question is, are you following certain standards so that there is an interoperability among the clinics, among the hospitals for the data which is captured at the time?
So one, is the data shared among the centers? No. The owner, when any provider buys our product, the laws are very clear that the data is owned by the provider, so the data stays with the provider, unless the provider decides, in this case the hospital decides to share data on email or any other mechanisms. So the data is not shared on our platform between providers today. In terms of standardization, yes, we've at a very local level, we have been able to standardize it. For example, the data that exists at a small and medium-sized businesses. So, for example, in these different platforms, most of the data is standardized and can be interoperable. But again, it's currently not being done.
Since you have actually already taken a lead and you have already implemented many systems, what is your personal view? I mean, is standardization really needed in these platforms? Or, whether it is going to give some advantage?
I absolutely think that standardization is critical for us to be able to use systems across, and we've been part of many forums with FICCI as well as CII, where we are trying to understand how we can standardize the data better. I think it'll be absolutely necessary for any meaningful use of the data for the standardization to exist. But I do think as technology progresses, you will start seeing, I come from a technology background, so I am zero healthcare knowledge, so I'm a computer science grad. With fuzzy logic and with the ability of machine learning and AI, even unstructured data can start making sense. So it's not, 10 years back it was only structured data, but going forward I see even unstructured data making sense. So standardization is very critical, but I would highly urge that the most critical call of the hour today is to create an incentive model in the country that will ensure there is high digitalization. At the grassroots level, the digitalization levels are really very poor. And I think that there needs to be an economic model to make that happen, which will really spur the innovation across the country.
Thanks, Shashank. I think, one of the things, I think this is a very important point you have put up forth, which I keep hearing, unless there is an incentive for people to use, it will be tough. But given what NHPS is going to do when it gets rolled out early next year, the National Health Protection Scheme, under which if the provider has to be a part of providing the services, they will need to have a platform. They will have to be using, otherwise how would you get your authorization approvals in using those standard operating procedures and guidelines? So I think that would be biggest probably incentive or disincentive, whatever you may call it. If you are not having that platform or tool, you are not part of the system. I think that could be one part, but of course, I think this is also something that has to be addressed. Thanks so much. Really appreciate it.